This is Dr. Deuk Majan, and we are live streaming from the Deuk Spine Institute, Surgery Center, Viera. It is now May 1, 2024, and our patient comes to us from Georgia. He has been suffering with back pain for 7 months? Excruciating. His MRI shows a herniated disc at L4-L5, which we believe is causing a majority of his symptoms. He also has a sacroiliac joint pain, and he has a piriformis syndrome. So he has 3 sources of pain. Marking pen. So number 1 is the L4-5 disc. Number 2 is the sacroiliac joint, and number 3 is the piriformis. 3 sources, okay? The SI joint is right here, SI joint. The piriformis muscle runs from here over to the hip. It's torn, causing horrible buttock pain. Yep, look at that. See that? I pushed and he tightened up because it hurt so bad. So he's got a tear right there, and this is the piriformis. He'll appreciate the fact that I'm doing this later. And we have a herniated disc. All right, are we ready? Let's get started. You're going to feel a little stick and burn, some medicine going, okay? Lay still.
You're doing great.
That's just medicine going in. Lay still. You're doing awesome. Everything's good. I'm putting the needle back down on the tray. All right, we ready? So, for those of you who have never seen this procedure before, it is an endoscopic procedure. That means we're going to do it through a tiny little cut. That cut is 7 millimeters, and the whole surgery is done through a little tube. Shot? Oh, it's really low, huh? Sorry. Everything's going good. I apologize. I know it's uncomfortable for you. I was hoping you'd be a little sleepier, but that's all right. We'll get you there, don't worry. You're doing great. Just lay still. Everything is fine. Don't get nervous. All right, so you can see we're in a little better position there. The first step is to get to the disc, and what I mean by disc is to the herniation. I would like to attack it from a little bit higher position. Let's do some more numb. I need pressure there. Both places, yep. I'm going to give you a little more numbing medicine, all right? All righty. Now, why is the patient awake? The reason is simple. We need the patient's help. But we only need it for a little while. Is that it? All right. So once I get to the herniation, which I'm on my way there now, we're going to put him to sleep. And he won't wake up again until the end of the surgery. You're doing awesome. Lay still. That's your facet joint. We use the X-ray machine to guide our surgical trajectory. It's looking good. You're doing great. Just lay still. You're fine. All right. How is he?
How are you doing, my friend? You okay?
Shot. All right. Well, we're at 4-5. What do you think for him to be responsive? 5 minutes? 10 minutes?
How are you doing? You okay? He's fine. Okay.
All right, good.
His head, moving his head.
Yep. So what we're going to do is, can we do the SI, you think? Oh, he's asleep?
He's awake.
He's awake? All right. Are you having any pain?
You having any back pain, sir? He says no. No back
Shot? How bad is that on a scale of 1 to 10? Did you see him
Give
hop
us a
up there?
number, 1 to 10
What's the highest it went? 10? All right. We got a 10. Is that where you get your pain? Yes? All right. L4-5, 10 over 10. Concordant. Yeah, of course. So basically, the L4-5 disc, if we had any doubt at all about whether it was causing his back pain, I have no doubt. Because I just injected it. I didn't tell him I was going to inject it, and he almost came off the table. He lifted his body up. So he said it's a 10 out of 10, and that's his typical pain. If you have any questions, feel free to ask. This surgery is only performed here at Deuk Spine Institute. It's called the Deuk Laser Disc Repair. Sean? If you go anywhere else, you're going to end up getting something else, and the other types of surgery available out there are not good. They have high complication rates, and the doctors are always destroying the muscles and tendons and ligaments to do the surgery. We're not destroying anything. We're actually just using this little metal tube that spreads the tissues apart and allows us to get into the herniation right away without doing any damage to the body. All right. We are at the herniation and the tear. We're going to enter the tear and herniation with the metal tube while the patient is asleep. And we're going to repair this disc while he's sleeping. Any questions from the audience?
At this moment, no current questions.
So Henry, let's show the audience how a herniated disc actually causes so much pain. What's the mechanism? Shot? And welcome back. We have entered the disc through the tear that's there in the back of the disc called the annular tear. And right in the middle of this tear is the herniation. So we've literally gone into the disc where the problem is. You can see chunks of disc material. These are all abnormal. Why? Because this is part of the herniation. Herniations are not normal. Herniations are abnormal. Some people ask, is this a discectomy? No, it's not a discectomy. We're not taking the disc out. This is a annular debridement, and it's only done as part of the Deuk laser disc repair. Now we approach this through a hole that's already there in the spine. It's called the neuroforamen. The neuroforamen is a natural opening in the spine. Everybody has it. And the technique of going through the neuroforamen was developed by an orthopedic surgeon by the name of Dr. Parvis Camben. He was at Pittsburgh. He taught at the university, and he taught this technique of going through the foramen to deal with the herniated disc. Absolutely brilliant. He developed the first transforaminal endoscopic equipment, taught the first generation of surgeons, orthopedic surgeons, how to do this. Everything okay?
Yep.
He's coming up for some reason. Is he just coughing? I see. No problem. I'm fine with it as long as you're okay. So, taught the first generation of orthopedic surgeons the transforaminal technique, and then that was picked up on by a few really good orthopedic surgeons, one in particular, Dr. Anthony Young, who taught me. Dr. Young had done almost 10,000 of these transforaminal surgeries, he told me, at the end of his career. He practiced over in Arizona, Phoenix, outside of Phoenix, and he is no longer operating as he's in his 80s. There's another surgeon in Germany who I also trained with, who was a student of Dr. Kammen, and a surgeon in Korea. A couple of surgeons in Korea. Grabber. So I was taught by several of Dr. Kammen's students, the ones that actually learned the technique and improved upon it, made it better. And then, of course, I improved upon it even further by adding the annular debridement, which is, I think, the most important part of the surgery, and it allows us to get rid of the back pain and the leg pain. All right, there's the annular tear. You can all see it. That's where we've been working. And the blue is the dye that we use to stain and identify the herniated disc that's stuck inside the tear. You can see this is all scar tissue. Everything okay? Yep. And we're going to use the laser, which is the glass fiber you're seeing, to remove these fragments of tissue, which is the herniation. Break it down into little pieces, which then come out. Any questions from the audience?
Yes, we have a question from Ping on Facebook
Ping is really active today. Yes, Ping.
asking, how long does it typically take for a disc to calcify?
Well, Ping has different definitions of calcification, but for the very beginning of the calcium process, several years, probably at least a year. Maybe more. I wouldn't expect to see any calcium in the disc injury prior to a year. Any other questions?
At this moment, no current questions.
Let's run our video on how the DLDR works. Almost done with this disc, 5 minutes.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And good morning, I'm Dr. Deuk Major. I'm here with a patient who's traveled from North Florida to visit us for his back pain. You came to us yesterday with 55 years of chronic back pain. You still have that back pain today?
I do not have that back pain today. I'm a little sore, but no back pain like I've had for 55 years. I got it 55 years ago when I was serving in Vietnam and had a helicopter incident and also a car accident over there. I have had chronic pain since that time and have had injections. None of that has helped, and I've gone through therapy and all sorts of things, but it wasn't until yesterday where you did some remarkable things to alleviate that pain that I've had for so long. I think the soreness is going to go away pretty soon.
Yes, it is. So you had disc pain and you had facet joint pain, both. We did the Deuk laser disc repair for the disc pain. With the laser, we went in and we cleaned out those two discs. You could see the tears in there. That's where your pain was coming from the discs at L4-5, L5S1. Then we did your facet joints because they were full of arthritis. You had degenerative disc disease and herniated discs along with facet joint arthritis. And we were able to treat all of those areas. Your pain is now gone.
Pain is now gone. Yesterday, the day of our procedure, your operation, it was my 81st birthday. So
Yes,
that's
congratulations.
That's a really good birthday present.
How did it feel to have your first meal without that back pain that you've had for 55 years?
Pretty doggone good, I have to tell you that.
It's not going to take too long to get used to that, is it?
It won't take long at all.
Now, your surgery was outpatient. It took us about 2 hours to do the surgery. How long were you here recovering for?
An hour and a half or so, but not very long. Left, I actually went home, had a little lunch back at the condo we rented, and a little nap, and then I was ready for my French restaurant.
Very good. What's life going to be like now that you don't have that back pain anymore?
Well, I think I'll be able to walk further than I ever have. I haven't been able to walk in the last few years very far. I've given up golf, and I know I can't really do that for about a year, but I may try that again too, because I see new opportunities for me walking and being more free.
You can golf in 3 months. You can go back to your full game.
3 months, I'll take it up.
All right, is there anything else you want to say to your fans out there?
If you haven't tried this Deuk Institute, Spinal Institute, you really ought to give it a chance. I have been fearful of an operation in my back. I really now find that this is the way to really treat the back problems. I've gone to various sports clinics. I really never had attention like this, but I have a friend that went through this just 3 months ago, and he is doing remarkably well, and that's what gave me the courage to call and say, I need to have a referral down there.
Congratulations.
Thank you very much, doctor. Really appreciate it.
Happy New Year to you and your wife.
Happy New Year, and to you as well.
Thank you.